11 signs your body needs more nutrients. Nutrients are vital in providing the body with energy, as well as regulating its processes and ultimately preventing diseases before they develop. A balanced diet should contain all the nutrients your body needs in the right quantities. If your diet is not balanced enough, you risk your body becoming nutrient deficient, and this can lead to various health complications. A nutrient deficient body can significantly change the way the body functions at its basic level. This involves changes in important processes such as digestion, nerve function, metabolism, and enzyme activity. Usually, your body responds to these changes by exhibiting certain signs, and while these signs are not very pleasant, they are a good indicator for the need to address your nutrient deficiencies as much as possible. Here are 11 of the most common signs your body needs more nutrients. 1. Hair loss. It is normal for a few strands of hair to fall out and regrow, but it is not normal when you suddenly begin to notice a huge clumps of hair falling out in the bathroom or under your pillow, because it represents key deficiencies in nutrients that are responsible for the growth and maintenance of the hair. Iron is an important mineral that is heavily involved in the synthesis of DNA in hair, and so when your hair stops growing and begins to fall out, it is possible you are lacking enough iron in your body. Additionally, you may also lack essential fatty acids such as linoleic and alpha-linoleic acids, as well as other vitamins such as niacin and biotin. 2. Fatigue. Intense physical activity can leave you feeling tired and weak. However, when you are intensely fatigued even after getting enough sleep, it could be a sign of deficiencies in essential vitamins and minerals. Vitamin B12, for example, is vital for key body processes such as oxygen delivery and metabolism. But as we age, the body can see a natural decline in how it absorbs this vitamin, which is why a deficiency in it can significantly increase your fatigue levels. Then again, magnesium is the mineral that aids the body's absorption of vitamin B12, and so your body cannot make use of the vitamin if magnesium is lacking in your diet. Additionally, a lack of iron also results in anemia, which is a major contributing factor for fatigue as well. 3. Paleness. Paleness is associated with a loss of color from your usual skin tone. Aside from the face, it can also be noticeable around the eyelid and in the mouth. The cause of this is a deficiency in iron, which leads to a loss of red blood cells, commonly known as anemia. Women are most likely to suffer anemia-related paleness due to the loss of blood during menstruation, but generally, paleness is supposed to go away within a short time in both men and women, and if this does not happen, it may point to a more serious underlying health condition. Other nutrients such as vitamin B12 and vitamin E are also linked to paleness, so it is important to ensure your diet is balanced enough to contain all these nutrients in the right proportions. 4. Mouth ulcers. Mouth ulcers and lesions in the mouth are another sign that your body is in need of certain important nutrients. Canker sores, for instance, point to a deficiency in iron, but studies have also shown that there is a significant link between persistent mouth ulcers and lack of B vitamins like thiamine, pyridoxine, and riboflavin. You can add these vitamins to your diet by consuming organ meats, dairy, meats, and eggs. Iron exists in good amounts in leafy greens and whole grains. Your healthcare professionals will recommend adding these foods to your diet if you encounter such issues, but they might also recommend taking supplements in much more serious cases. 5. Muscle cramps. Muscle cramps are involuntary muscle contractions that mostly affect the legs. They can be quite painful but usually go away within a minute or two. While the exact cause may not be known, it is normally associated with athletes or people engaging in intense activity, as well as pregnant women and people older than the age of 65. Evidence, however, suggests that a diet without enough magnesium and vitamin D and B can be causes of muscle cramps, and this is due to their various functions in relation to bone and muscle development. Muscle cramps are generally not considered harmful, but you need to visit your healthcare provider if it becomes more frequent. 6. Poor vision at night. When your vision at night is not clear enough, you might be deficient in vitamin A. Not enough vitamin A will cause dryness in the cornea, leading the eye to be cloudy and effectively rendering the eyes unable to see properly at night. In some cases, it can even result to complete blindness, which is normally represented by marks on the eyes, known as Beetle's spots. Supplementing your food with vitamin A can improve this condition, but it is recommended that you see your ophthalmologist for a thorough evaluation of what to do next. But you can always try to ensure your diet is richer in foods rich in vitamin A. This includes foods like eggs, fish, spinach, and other leafy greens. 7. Dandruff and scaly patches. Dandruff comes from a group of skin disorders that attack the areas of the body that produce oil. This is equally the case for seborrheic dermatitis, a similar skin condition that affects the scalp and other areas of the body, including the armpits, face, chest, and groin. You can be affected by these disorders for a variety of reasons, but one of the most common of them is as a result of eating an unbalanced diet. The deficient nutrients in this case are specific vitamin B variants, like riboflavin and pyridoxine. Your healthcare provider will perform tests to confirm the absence of such vitamins and consequently recommend foods that contain enough of such vitamins for you. 8. Bleeding gums. Your gums can suffer bleeding when you brush too hard, but sometimes it can point to a bigger issue than the brushing mode itself. Usually, this often points to a lack of enough vitamin C in your diet. Vitamin C is essential in healing wounds and boosting overall immunity. It also acts as an important antioxidant to help prevent cell damage. The key to note is that the body does not make vitamin C itself, and so it is important to have enough of them in your diet. The best sources of vitamin C are in fruits and vegetables, such as oranges, kiwi, and tomatoes. You should also aim to quit smoking if you do smoke, because what smoking does is to hinder your body's ability to absorb vitamin C properly. 9. Impaired cognitive function. Certain nutritional deficiencies can cause your brain to develop lapses in its functioning. This kind of brain impairment is often characterized by moments of forgetfulness and confusion. In certain cases, it might also completely stop you from being able to work or complete difficult tasks successfully. A deficiency in vitamin B12 iodine is seen as a major risk factor in such situations. Additionally, a lack of omega-3 fatty acids can also increase the likelihood of conditions such as depression, which then contributes to impaired cognitive function. Note that frequent occurrences of impaired cognitive function are associated with the far more serious brain-related disorders, such as dementia and Alzheimer's disease, and so it is important to visit your healthcare provider when these symptoms occur consistently. 10. Digestive issues. Constipation, diarrhea and indigestion, as well as other digestive issues, are common cases of a lack of nutrients in the body. Fiber, for example, helps increase the size and weight of your stools, effectively making them easier to empty. In addition to this, fiber fights against inflammation caused by indigestion, ultimately relieving your stomach from pain during and after digestion. Magnesium, on the other hand, also draws water into your small intestines in order to make the digestive process smoother. Other nutrients such as iron, vitamin D, and zinc have various roles in aiding digestion, and so if you continue to suffer from related issues, you will need to watch your diet and visit your doctor for advice on what your diet needs specifically. 11. Weak bones. If your bones are fragile, it may tend to cause you a lot of pain, and this normally indicates a deficiency in vitamin D and calcium, two important nutrients that regulate bone density and health. To prevent this, be sure to fill your diet with foods that are high in vitamin D first and foremost. Good examples include salmon and shrimps. Aside from food sources, you can also step in the sunshine for a few minutes for a good dose of essential vitamin D. That aside, your diet should also have enough calcium in it. The best calcium sources are sardines, milk, cheese, and other dairy products. Note that continued vitamin D and calcium deficiency could lead to different types of cancers and autoimmune diseases, so it is important to not take any sign of weak bones lightly at all. Conclusion: eating a balanced diet should help you avoid most of the symptoms that are associated with nutrient deficiency, but you should also always consider speaking to your healthcare professional on what your body needs, depending on your age and lifestyle. This will help you maximize the benefits that nutrition provides.